So welcome. It is 7 o'clock. We will be allowing or admitting people one by one as we go along here, but let's go ahead and get started. My name is Ronnie Shure. I am the volunteer as the president of our board of directors for Healthcare for All Washington. Tonight we'll discuss our legislative agenda, give you an overview of the victories from the 2024 session that we are starting to see some action on. Our lobbyists will talk about healthcare leaders for this upcoming session in 2025, and we members of our committee will talk about the bills that are coming up in the legislature that are at the top of our agenda, and as well as federal actions that are going on. We will have an update of the Washington Health Security Trust. Chris Currie has been leading us in updating that information. And then we'll talk about using Take Action Network, a way to communicate with your legislators, or one of the ways. So thanks for joining us tonight. You too, like me, can volunteer with Healthcare for All. Please consider doing that. You can join our policy committee or communications committee or a fundraising committee or outreach committee. But in addition to just committees, if there's a specific project or two you'd like to join us on, please go to our website and volunteer. There is a good a number of people that have come in and given us some great ideas and ways to get involved. In the chat, we will be posting a link to our website where you can do that. There's a button that'll say get involved, and there's also a donate button. If you are able, please make a donation. Every donation helps us get a step closer to universal health care. And we've set a goal to raise $250 during our program tonight. So please look at the chat to find that link. And you can peruse our website, looking at our goals, and there's a number of reasons to get familiar with it, because we do add a monthly newsletter. Our communications committee has been very active in getting that information. If you have questions, please enter them in the chat. We will have a short time for a question and answer period after the presentations, so please go into the chat to do that. You can go to the bottom of your screen and just hover over that bar will show up at the bottom of your Zoom screen, and click on chat. Also, while you're down there, you can see a button that says closed caption. Icon will pop up. If you're having trouble understanding one of us, then you can click on that button. I guess I should make sure that I have activated that. So, and I think we have. So let's me acknowledge the lands that we are having this Zoom meeting above, the lands of the Coast Salish people. Our efforts to achieve healthcare for all includes the peoples of this land and immigrants from other lands. Please take a minute to acknowledge the people in the lands where you're joining us today. We acknowledge all the ancestral homelands and traditional territories of indigenous peoples who have been here since time immemorial. Our efforts to achieve healthcare for all includes universal healthcare coverage for Coast Salish peoples of this land, the land which touches the shared waters of all tribes and bands within the Duwamish, the Muckleshoot, Puyallup, Suquamish, and Tulalip tribes. So we will get started, as I mentioned briefly, with an overview of the session, and let's highlight Lonnie Johns-Brown, and let me introduce her. Well, let me highlight myself. And there's Lonnie. So, Uh, Lonnie has lobbied in Olympia since 1985 and has represented over 20 nonprofits in the areas of healthcare and human services and women's rights. She also served as a legislative director for the Office of the Insurance Commissioner for 6 years. And since retiring from there, she has returned to lobbying and consulting with us. She's also represents Planned Parenthood, Upstream, Quaker Voice for Washington, and Washington Against Sexual Exploitation. She's a native Washingtonian, currently lives in Tumwater, and Lonnie is going to share an overview to get us started.
Thank you, Ronnie, and good evening, everybody. It's really nice to see all of you interested in what's going to be happening this coming session. I think you all know that this is a pretty remarkable year that we're facing. It's the first time in 12 years that we have a new governor. We're going to have a new attorney general, a new insurance commissioner, and a new commissioner of public lands. We have over 12 new senators. We have 19 new members of the House, and we have changes in almost any committee that you can think of, including the Healthcare Committee. So I'm going to start with that. The House Healthcare Committee has a new chair, and Representative Bernowski. It also has two new vice chairs for their first time in my memory, Representative Lakanov and Representative Rule. And of the committees, of that committee, there are two new legislators, two new members who are new to the legislature. In the Senate, the chair remains the same. It's a bigger committee this year. There's 11 members. And of that, on that committee, 5 out of the 7 Democrats on the committee are new to the Senate, but all of them have been in the House. And there's one new Senate Republican senator, and he also came from the House.
I still don't hear her.
So you can, I'm sorry, somebody just said they couldn't hear me. Do I need to speak up a little bit more? I have my volume up. Sorry. So as you can see, lots of new faces, and they will not, they're going to take their time getting going this year because, of course, the new governor's appointing heads of agencies, new staff. The same will be true. We have a new Senate Majority Leader. And the big thing that they're facing, of course, is a huge projected deficit of $12 to $15 billion. And at $15 billion, that's almost a third of our entire budget, biennial budget. So that is job one, and you might have seen articles where Speaker Jenkins and Majority Leader Peterson have pointed out that that's job one. On the healthcare front, though, there is a lot to be done. Folks are nervous about what the federal government's going to do, but so far they haven't done anything, and so we need to just proceed with our work starting on Monday. So I think what I'd like to talk to you about now is what we've identified so far, because bills are dropping every single day and will continue to be pre-filed until Monday, and then continue to be filed in all through session, frankly. We have identified 3 areas as our top tier items. And the first is Senate Bill 5086, which our prime sponsor is Senator Robinson. And in the House, Representative Lakanov has offered to be the prime sponsor of the companion. That bill came out of a study that Healthcare for All Washington asked to be done about looking at the benefits of combining the PEB and SEB boards and their their pools for the purposes of purchasing healthcare. Larger pools usually mean more negotiating power and more potential savings, as well as some savings from just being a little more streamlined. And that report has come back. Senator Robinson is moving forward with it. And we are very pleased about that, because our goal is to see if this can be made to work. Shall we look at other ways of combining and streamlining the state's healthcare purchasing? The second issue that we are moving forward on this year comes out of another study that Healthcare for All requested that the Health Benefit Exchange do, and that was to look at better ways of helping folks that lose Medicaid get enrolled in other health benefit exchange plans, preferably no cost or no low cost plans. And we're very pleased that that report came back, and they said that yes, indeed, that they had identified some ways to make that happen, modeled after some of the states have actually done various forms of auto enrollment. And one of those states is California, who's moved totally to an auto enrollment and very successfully have retained folks having healthcare coverage through that method. We have both Senator Richelli and Senator Robinson and Representative Macri all interested in moving forward with this. And the Health Benefit Exchange has generously proposed in their own report to use $4 million of their own account to help pay for implementing this process. So we're very excited about that. We're most likely to do that in the budget. And the last thing that we are very focused on in these tough budget times is maintaining the funding that the Healthcare for All group got in the 23 budget year to increase staffing for the Universal Healthcare Commission and their FTAC committee, as well as make sure that they had the ability to hire consultants to work with the Universal Healthcare Commission and FTAC. And in these budget times, holding on to the increased funding is going to be, that's going to be a challenge for us. So those are our top three things that we have been working on. And Denny, do you want to talk about the tier 2 items as we move into the next phase here?
Yeah, let's highlight Denny and bring him in. Let me introduce you. Well, I'll introduce Denny to everyone. So Denny is a member of our board of directors. He's had a long and successful career in law and community service. He served as Spokane's 3rd legislative district state representative from 1983 into 96. In fact, he was chaired the healthcare committee, as well as the banking insurance committees. And he's worked on the powerful ways and means committee. So it's been wonderful to have him as a part of our guidance. He's been involved in legislation since the Basic Health Plan for several decades, and some of the changes that have occurred, including being a member of the Universal Healthcare Work Group, which was started through a budget proviso that has led to the current Universal Healthcare Commission. So Denny and Lonnie, should I keep you up on the screen to work together with Denny? But Denny, if you could unmute yourself and get started.
Okay, now I am out. Okay, well, thank you, Ronnie. Um, I want you to understand how vital Lonnie is for our objectives. It's her that's able to get access to the chairwomen and men of the legislature to talk with staff, to work through any problems that we have. Without her, I don't think we would be able to do as well as we have done. As you've noticed, she covered some issues that are the critical issues. We call it in a level 1. We also have level 2, which is obviously the next level. And we think the bills and resolutions in this level are important, but not as critical in level 1. We will work with legislators and proponents of the legislation. We will let committees know how we feel. We will send in our endorsement of that legislation if we think it is endorsable. We will also let the committees know how we feel. Send our members notice so that they will be able to send letters to the committee, to the members of the committee, and let them know how they feel as well. We want to get everybody involved in it, but not as much as we are going to be involved in level 1. The 4 bills that I've highlighted under this level 2 are, the first one is Senate Joint Memorial 2004. A joint memorial, as we might guess, is a resolution passed by each house that is sent then to the United States legislature, the president, and to various officials of federal government, asking them to do something. In this case, it's a joint memorial that would say, number one, that we are having tremendous problems with our health care, and that we want to go ahead and pass legislation, but are ending up facing some of the restrictions that the federal government has put in the way. We need the help from the federal government to get waivers so that we would be able to proceed with what we're trying to do. And this not only asks them to do that, it also shows that the members that signed on the joint memorial agree. And that is that we need to do something. We need to have universal health care for the state of Washington. And that's a good step. It's a good admission by legislators that there is a problem and that we're going to do something about that. We saw how big of a problem healthcare is and this expenditures when our President Biden tried to have the IRS, not the IRS, but any application for a job require that you put down your medical debts. In other words, exempting your medical debts from taking away from your fiscal responsibility. And sure, that's one of the biggest debts of people in the state of Washington and in the United States, medical debt. So the second one is on level 2 is a health equity for minor immigrants, a budget item. We support the current level of funding, and because we're having so much trouble with deficiencies and the budget might be amended or will be amended, we want to try our best to see that the immigrants are not going to be the first place they take the money from. We want to have at least the current level kept. The third bill is Senate Bill 5083, and it's directing healthcare authority to use reference-based pricing. And reference-based pricing is where you use some other existing cost measure in setting the new budget. So an example would be if a doctor or a hospital did a procedure, they would be allowed a certain amount of money based upon the highest of, and then they list all the existing, like Medicare. It'd be measured by, let's say, 150% of Medicare payment for that particular service. So it's an easy way for the healthcare authority to develop price set. They'd be able to arrive at that without having to go through too much more of the investigation. And the fourth and last one is an effort to support revenue to avoid budget cuts in the healthcare authority. And you can see that we've had a budget that includes some new revenue sources or expansions of existing sources. And we want to support the reasonable efforts to generate new revenue. so that we will not have to have the budget cuts in healthcare authority or in the other ones that I've mentioned, like the immigration healthcare. Those are the four that we chose to talk about that would be the secondary level of our support. Not that we don't think it's important, but it isn't where we would be spending our money and requiring or asking our asking Lonnie to spend time on. Thank you.
And Lonnie, do you have any comments about our relationships and supporting those bills that Denny described?
Well, in all the items that Denny described as tier 2, there are other groups that are leading on it, or large coalitions that we're part of, and so we will support those efforts and take on tasks when assigned. On the first tier items, those are ones where we will lead and ask our allies to support us and help us. The other thing I would just reiterate is this is not our final list in terms of certainly tier 2 and tier 3 items, because more bills are going to come that we're expecting, several that I think are very, very important, but have just not been filed yet. And so we will adapt as the session moves forward.
And thank you for giving us that starting overview. And like Lonnie and Denny have said, this is a beginning point. And a number of our allies have been been promoting bills that will have a great impact on universal health care. And so as those show up, we certainly will be supporting more bills than that our allies are leading on. So there's a lot going on in our community. So thanks for that overview. Let me bring up and move to the next section. We'd like to talk about the Washington Health Security Trust. And let me introduce Cris Currie, who's been a very active member of Healthcare for All Washington and our policy committee, and working closely with other allies in our community. Cris is a retired critical care and home health RN and from Spokane, Washington, and often runs into some rural health issues about internet Wi-Fi connections, but we're hoping that the night will bring some more clear connections. Cris has written and updates an ebook on our website called Medicare for All with Q&A answers there, and has been updating that to really cover the history of Medicare and to talk about the insurance program which is called Medicare Advantage, but is really not Medicare, but also other essential parts of a single payer healthcare system. He's also been a leader in updating our Health Security Trust bill, and we have just gone through a process. He has led our policy committee to update the information in that bill. So, Cris, do you want to unmute and take it away from here?
Okay, thanks, Ronnie. The Washington Health Security Trust is also known as the WIST, so I'll be using that when I refer to it. But first, a quick bit of history. The seed for the WIST was planted in 1990 by the chair of the House Healthcare Committee, Representative Dennis Braddock. He was inspired by the Canadian healthcare, where the government, rather than private businesses, provide health insurance, and he proposed a similar system for Washington. This led to the Health Services Act of 1993, when Denny was chair of the House Healthcare Committee. But unfortunately, it was scuttled by the Republican legislative landslide in 1994. So then in 2000, a group called the Washington Single Payer Action Network filed Initiative 725, which would have created a separate single-payer, independent trust, primarily funded by a 9.5% payroll tax. After it failed in 2001, the group changed its name to Healthcare for All Washington, which is where we are today. And the initiative was updated every year as the Washington Health Security Trust. It was introduced as a bill 5 times over the next 10 years. It was last introduced in 2019 as HB 1104, and gaining no traction, and with the advice of key legislative champions, HCFA changed strategies to advocate for the Universal Healthcare Work Group that studied 3 options, and the current Universal Healthcare Commission that is charged with designing the unified UHC system. So over the last year, the policy committee reviewed some 20 proposals from other states and revised the WIST to more carefully define the essential guiding principles for what we think is needed to legislatively propel universal health care forward in our state. So the goal of this revised WIST is to lay out the foundation for a fair and equitable, accountable, simplified and lower cost, universal, state-based, single-payer healthcare financing system with a comprehensive package of personal health benefits. As such, we think once passed that it should be sufficient to interest the federal government in helping us secure federal waivers and other means for redirecting federal healthcare funds through a state system. Just as the 1993 Health Services Act served as the basis for Romneycare in Massachusetts and then the Affordable Care Act, we think the WIST could serve as a model for a national single-payer system. Since the Universal Healthcare Commission has committed to discussing the actual system design in 2025, rather than continue to focus on transitional solutions, we expect to present the WIST to the Commission in June with the hope that they will adopt all or part of it for inclusion in their own legislative bill. So briefly, the WIST is designed to be as brief as possible, frequently offering preferred options rather than precise prescriptions to maximize its chances of passing. It's not our intent to describe specifically how the system will be fully funded. We want legislators, agency staff, and the trust board to debate and devise the final funding plan. We know they can do this if they are sufficiently motivated by the prospective savings of billions of dollars and their interest in meeting the healthcare needs of their constituents while also resolving Washington's severe healthcare crisis. And we want the future board and staff to be the ones to work out the details of implementation, management, and monitoring, since they are the ones who will be responsible for running it. So the WIST represents a different strategy than that being used by Whole Washington, one of our allied organizations. Their bill, the Washington Health Trust, introduced as SB 5335 in the last session, was originally based on the WIST, but they greatly expanded it to include a detailed funding and enforcement plan, as well as lengthy additional provisions. HCFA has supported that bill as well and will continue to do so, since it presents additional options from which to choose. So here are the core provisions of the WIST. It requires all residents to be covered with the same essential health benefits, including vision, hearing, and dental, regardless of health, age, sexual orientation, or employment status. It requires that no cost sharing in the form of co-payments, deductibles, or co-insurance be required of residents. It allows residents to choose among any participating provider. It makes health professionals and patients the decision makers, not profit-first insurance companies. It means health professionals will continue to work in the private sector, not for the government. It requires that a public board of trustees govern the WIST with complete transparency. It requires the board to establish at least 3 advisory committees: a citizens, a technical, and a financial advisory committee. It requires holding regional public hearings on a regular basis to receive comments, complaints, and suggestions regarding regional healthcare needs. It requires the establishment of a new community needs assessment program to better serve rural and low-income parts of the state. It requires that policies be established to reduce health disparities, including but not limited to mitigating structural racism and other determinants of health as set forth by the Office of Equity. It recommends various cost control measures to be utilized, particularly for prescription drugs. It requires a uniform electronic medical record and simplified reimbursement system. It requires the board to set reasonable payment rates for providers. It recommends that practitioners be reimbursed based on their training, expertise, and time needed for each procedure, rather than on an assigned value to the procedure itself. And it requires that payment rates for behavioral health services are comparable to other rates. It emphasizes care coordination and integration and rewarding education time spent with patients. The WISP recommends a health security assessment to be paid by all employers in Washington State and a monthly health security premium to be paid by Washington residents with incomes over 200% of the federal poverty level, subject to exemptions. But with regard to creating the final funding plan, it requires that the trust board, in consultation with the House and Senate Appropriations Committees, the Department of Revenue, and the Office of Financial Management, work out the details, along with any other possible sources of funding. It does not prohibit self-insured employers from continuing to offer their self-insured plans, but they will still be subject to the payroll assessment, so most will likely voluntarily drop their own plans as their employees gradually shift to the state plan. This approach is likely to withstand an ERISA challenge. It prohibits the sale of private insurance policies that duplicate the benefits of the trust, but allows for private supplemental policies for items not covered by the trust. It makes the trust a secondary payer for all residents covered by a federal health program, including Medicare, until such programs can be fully included in the trust through federal waivers. And it includes provisions for a reserve account, a displaced worker account, and an education and training account. And finally, it declares that the intent of the WIST is to become part of a national system when one is enacted. It's available for download at healthcareforallwashington.org under important resources and papers.
And in case you didn't get all of that information down, let me share that it is available on our website under resources, important resources and papers, and an updated Washington Health Security Trust. So the information that Cris has shared is readily available as we begin to address those next steps in our system. So, Cris, is there anything more to add?
Used up my 10 minutes, so.
Well, thanks for that information. Also would like to share that I mentioned the book that the online book that that Cris has written, which is available on our website and is in a form of a PDF or just online reading that you can identify or review some of the information he's done. Cris has really put a lot of work into that information. So thank you for all of that. So thanks, Chris. Remember that we are putting our website link is in the chat. So please feel free to go there. And if you are able to make a donation, please add that in as well. So now I'd like to we've talked about the state issues and the priorities that we've developed in our policy discussions there. But let's talk too about the federal issues that are going to be a difficult track for us to move on, but which are so important for us to focus on. We've asked Chelo Echeverria, who is a board member of Healthcare for All Washington and chair of our outreach committee and very active co-chair of our communications committee. She also is on the organizing committee of the Coalition of State Healthcare Allies, the Healthcare as a Human Right Coalition, and also on the board of Physicians for a National Health Program.
Enough.
Enough. She's, a grant writer, program manager, has, worked with refugee and immigrant and community-based organizations to promote health. She is a great asset to our movement. And she's going to share some of the national issues, the federal issues that we are including on our legislative agenda as well.
Thank you so much, Ronnie. We all know that Washington, D.C. is going to be a bit of a chaotic session for the next 4 years, possibly only 2 years. We'll see what happens. But within that, our allies that are working on national bills do feel like there is some hope. And one of those bills is the State-Based Universal Health Care Act. One payer state has been a lead on that, and we really feel that this is a bill that could very possibly get bipartisan support. The State-Based Universal Health Care Act, H.R. 6270, is designed to make it easier for states to create and fund a comprehensive universal health care plan by allowing a waiver of some federal rules. This bill was reintroduced in 23 by Ro Khanna and will be introduced once again in the 2025 session. Now, what does SBUCA do? It requires state-based plans to have benefits equal or greater than current federal programs. It mandates that the states guarantee health care coverage for at least 95% of residents in the first 5 years. Very important, it enables states to integrate Medicare funding into their plans. It also allows states to come together and submit joint plans for the waivers, which is a really excellent asset of this particular bill. And it gives access to the ERISA waiver to reduce legal challenges to a state plan, thus giving states more legal certainty in legislative efforts. So where are our representatives in D.C., our members of Congress in D.C., where are they on supporting SBUCA? So in 2024, only Pramila Jayapal and Smith were co-sponsors. The other 9 representatives were missing. In July, Senator Markey of Massachusetts announced that he will introduce a Senate version with Warren as a co-sponsor. To date, neither Murray nor Cantwell have signed on. Now I'd like to move on to a second bill called the Health Over Wealth Act. And this is, I believe, really in response to the fiasco of Steward Health in Massachusetts. Once again, our lovely Representative Jayapal and Senator Markey introduced the Health Over Wealth Act, requiring greater transparency for private equity firms, venture capitalists, and for-profit companies that invest or own healthcare entities. And I'm just going to quote Senator Markey because I love this. Private equity firms and greedy corporate executives are using the healthcare system as a piggy bank. And the hope is this bill is a strong start to fight the corporate greed. The third bill that we're focusing on is really trying to tease out the difference between Medicare Advantage and Medicaid and Medicare. And it was introduced by Jan, I'm going to mess up her last name, Schakowsky. Is that correct? I hope. Once again, our own Jayapal and Senator Markey. I'm sorry, wrong thing. Schakowsky, Mark Pocan of Wisconsin, and Rokana of California. They are reintroducing it, and it prohibits private insurers from using the word Medicare in their titles or advertisements, and really importantly, it imposes significant fines for those engaged in this deceptive practice. In February 2024, it was referred to the Subcommittee on Health, where it is stalled. Now, these two bills, support of Health Over Wealth and Save Medicare, besides Pramila in Washington State, there has not been a single Washington State member of Congress who has signed in on support. We will be calling on Healthcare for All members to help get their members of Congress on board. Thank you very much.
Thanks, Chelo. Thank you so much. And now I'd like to bring in another board member to talk about a avenue to communicate or to connect with legislators. Ron Lovell is a member of our board of directors. He's been active in both our communications and policy committees. He's been super active in them since he moved to Washington in October of 2021. He has worked in lobbying on a number of areas in his life as a realtor and a small home healthcare startup. We both worked together at a psychiatric hospital in Norfolk, Virginia. So he served in the Navy, and he has been has served our organization in a number of different areas. So, Ron, why don't you take it away to talk about the Take Action Network? Unmute yourself and take it away.
Okay, I'm going to share my screen and talk about the Take Action Network. I seem to have gotten to, there we go, to start off. Okay. What is the Take Action Network? Basically, we recognize that your time and energy are very precious, and we put it to use quickly and effectively so that you're not wasting your time searching for actions to take, but can quickly take actions. Our legislative session starts on January 13, and so far we have more than 1,000 bills already pre-filed. We provide you with personalized actions and events that match your interest, your values, and your ability to get information from trustworthy sources. We're categorized by the details that you provide when you visit your dedicated feed at any time to find the most timely and relevant actions for you to take. Here's what it looks like once you're in the system. This is my personal dashboard. Yours would look similar. The current action that we have is this event that we're talking about tonight. But as we get into the session, what you will be seeing is bills that we are currently monitoring. It also gives you a link to all of your elected representatives. Now, this is taken from today before, where there were a few changes, since you know that Patty Cooter was elected to the office of Insurance Commissioner and has been replaced by Vendetta Slatter. This is my representatives in LD 48 here in Bellevue. Your list will reflect your representatives as well as your state and federal officials as well. Here we can see the bills that we've already started to monitor. You'll get specific actions on, as these bills are presented to their respective committees for deliberation, you'll have an opportunity to let your representatives know your feelings about these bills and others. Here's an example of what you would get. This is actually taken from 2024 session, but this joint memorial resolution requesting the federal government create a universal health care program. And so this is the kind of thing that you would get in your feed. It gives you information about the bill. It gives you a specific script that you can send to your representative. It gives you links to your representatives. These are my representatives from the last session, but it will be your representatives that are shown on your information feed in the Take Action Network. Basically, the Take Action Network gives you direct connections to bills and to your legislators, information about the bill, its current status, timely prompts for your action, guided information to send to your legislator or your committee, and quick links to express your opinion. You can scan the QR code that you see now, and it will give you a link to go ahead and sign in. Or you can type this down, https://bit.ly Healthcare for All Washington-10. When you click on that link or the QR code, this is what you will see. Basically, you type in your name, your address, your email address, your personal password, and then it will take you to create your account. So that is the Take Action Network.
Thank you, Ron.
Okay.
And
Stop my screen share.
And it does give access to any number of areas. Remember, healthcare alone is not the only answer. Social determinants of health also impact our work. And it's an easy way to stay in touch with the progress of bills. You also will see that information on our website. Our communications people continue to do that, or to provide highlights as we move along. Now let me bring up another board member. Peter Lucas is a member of our board of directors and the treasurer for Healthcare for All Washington. And he's, as you might expect a treasurer to do, going to do a fundraising pitch. Remember that Peter has been entering the link for our website into the chat. So please feel free to go in there and make a donation at any time. And I think there are a couple of questions that are showing up in the chat. We'll be able to try to answer a few of those after we finish this last presentation. Peter, take it away.
All right. Well, thank you all for coming, and we all learned a lot. And you heard tonight about all the legislative work Healthcare for All Washington has done over the years, and where we plan to go from here. Our organization has supported legislative actions since we were established way back in 1994, including the Washington Health Security Trust, or the WIST, which is a bill to create a single-payer system in our state, which was first submitted to the legislature in 2003 and reintroduced every couple of years after that. Currie spoke about this bill a few minutes ago and described what it's all about. In 2020, as things were sort of we're not getting a lot of traction with that bill, we got on board with the Pathway to Universal Health Care when several of our members joined a Healthcare Authority work group, which in turn became the Universal Healthcare Commission. That was just a few years ago. And again, as you heard earlier, the mission of this commission is to establish a proposal for universal health care in our state, which we hope will be a single payer plan. And we have been intimately involved with the commission. For instance, we recommended many advocates who became members of the commission. We also successfully advocated for increased funding to facilitate and speed up the work. A big part of this has been our professional lobbyist, Lonnie Johns-Brown, who you heard from at the beginning of the meeting, as well as other board members, volunteers, and supporters who maintain close contact with legislators who provide education and guidance to help legislators draft bills and to enlist other allies in Olympia. And we are fortunate to have forged strong bonds with many of these legislators who support our mission and work to bring it to fruition. Now, these things don't come for free. They require financial support in terms of personnel, outreach efforts, and administrative support. So that's why we're asking you to help us continue this work by making a donation tonight. And I have put several links to donate in the chat, so please just click on those links to make your donation. And many of you have donated previously. We appreciate your past support, your present support, and future support. And we believe that together we can achieve cost-effective, high-quality universal health care coverage in Washington state. So thank you so much for attending and for your support.
Thank you, Peter. And thank you, Peter. And so feel free to go into the chat and you can find links to our website. You can find that information. You can volunteer there, and we'll continue to provide the more detailed information as the legislative session goes on. I wanted to see if there are any questions in the chat. Chelo, have you noticed anything that we can respond to quickly, or?
I responded to Gary. If
So there was a
people would
question
like,
about a bill number.
yeah, if people would like, I can put all three bills in the chat if people would like that. Show of thumbs.
Ronnie, someone asked whether or not the bills that Dinger and Taylor are working on about vertical and horizontal consolidation of health
Coca,
plans,
yeah.
etc. They haven't dropped those bills yet, but we expect them anytime. So I don't have bill numbers for you right now.
And Lonnie, there have been a couple of bills that are controversial in that area. So we haven't seen the ultimate bill yet. So we are watching that, and Lonnie will share that with all of us to compare those bills. There certainly are some bills that we have to say we don't support because of restrictions. So it'll be interesting to see the work that Taylor and who really presented the main COCA bill last year, what they're able to come up with to get before us in 2025. It'll be a hard session because of the budget issues, and I think it's going to need our 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 detailed and our hard work to make sure that the legislature doesn't balance the budget on the backs of poor people. So it's important that we pay attention to this. So thanks for joining us and showing this interest. Be aware that next month, on the second Wednesday of February, the 12th of February, we'll take a deep dive into our priority bills and provide some more details. And so please join us on February 12th. Thanks to Lonnie, to Denny and Chelo and Cris and Ron for their presentations tonight. Thanks to the volunteers behind the screen that you don't see, Rich Legoo and D.W. Clark, and Ron Lovell has been working behind the scenes as well. And also want to thank our communications team who got the word out to alert each of you about this opportunity. So thanks to Marcia Stedman, Sydney Jones, again, Ron Lovell, to Connie Rock, and also Chelo Echeverria and D.W. Clark, who worked together on our communications team. And thank you for everyone who's volunteered to join them. And we've had a couple of volunteers tonight. So thank you to each of you for joining us tonight, and join us again next month for a little bit deeper dive into some more specifics. And please pay attention to it. It's great to see so many familiar faces tonight, to be paying attention to this upcoming legislation, or this legislative session. So thank you all very much. And have a good evening. Happy New Year.